Hello, in this video, I'm going to explain the difference between vasoconstriction and vascular spasm, which is also referred to as vasospasm. So, vasoconstriction is simply when the smooth muscle in the wall of a blood vessel contracts, which causes the lumen or the space inside of the vessel to decrease. So, if we look in our picture here, here is a normal artery. Here's what happens when it vasodilates, so the lumen becomes larger. And here's what happens when it vasoconstricts. So the lumen becomes smaller. So the lumen simply means the space inside of the vessel. So as we vasoconstrict, it gets smaller, and we vasodilate, it gets larger. Now, this is happening constantly throughout the body. It is just a normal function of blood vessels. That happens all the time under normal, healthy circumstances to regulate blood pressure, body temperature. So we divert blood flow away from the skin and towards our visceral organs when we're cold. When we're hot, we send more blood out to the surface of the skin so that we can radiate heat off. So we regulate body temperature that way. We also redirect blood flow, like in a fight or flight situation. We're going to send more blood to our muscles, heart, lungs, brain, and less to like digestion and so forth. So vasoconstriction happening all the time, totally normal, totally healthy. Vascular spasm, also referred to as vasospasm, is really still vasoconstriction. It's still the narrowing of the lumen of the blood vessel, but in this case, it's in response to injury of a blood vessel. So in this case, the purpose is to reduce the blood flow to that vessel so that we reduce how much blood we're losing from the broken vessel. So it's triggered by damage to the smooth muscle in the vessel. So it'll cause the surrounding smooth muscle to contract and close the vessel. It's also triggered by chemicals that are part of the hemostasis process. So chemicals that are released by the endothelial cells in the blood vessel and also released by platelets that are coming by and getting stuck to the damaged area. Can also be triggered by reflexes that are initiated by pain receptors that are essentially signaling that there is an injury here. And so it causes the blood vessels in that area to, clench up, so to vasoconstrict or vascular spasm. So vascular spasm is step one of three in hemostasis. So hemostasis is how our blood vessels prevent blood loss when there is an injury. So if we look at our picture here, the first step is vascular spasm that we're discussing here. And then as the vessel is constricted, that can last like 20 to 30 minutes, which is often long enough for the next two steps to take place. So the platelet plug formation, and then finally coagulation, where we have the fibrin fibers that are coming to bind, and then it holds there very steady, usually, and lets the blood vessel heal. So vascular spasm is a really important part of the process because it's helping to kind of stop the blood loss or lessen the blood loss as much as possible while the next two steps can take place so that we don't just hemorrhage and lose too much blood. All right. Thank you so much for watching this video, and I hope you have a great day.